That segues very nicely into the next speaker, Dr. Tjia. Not a real doctor, a medical doctor. He's working on getting a real doctorate. I don't know if you noticed when Leonie was talking about the health industry being sceptical of markets, the fierce nodding that was happening in the corner, and the left-wing vibe of health. And yeah, Liam's actually doing something to fix that himself. He's going to tell us about an idea of a missing market that has been almost regulated out of existence, but should exist, and he's trying to help it exist. So please welcome Liam.
So my name's Liam. Thanks for your time. I'll mainly be talking about the clinic that I'm starting up with, which is a nurse practitioner clinic for children's healthcare, especially acute children's healthcare. But I'll just make a couple of prefaces. Dr. Buckingham, I'll paraphrase here, said that education is a sector. There's not many sectors that are more ripe for innovation and the influence of the free market. Well, may I bring you healthcare, ladies and gentlemen? Another thing I'll keep in mind when we try to keep this brief, another thing about healthcare, and I think something that has been a barrier to reform that we've seen in the financing sectors and other sectors, is that it is just not inherently a very interesting topic to talk about, the economics or the business of it, it seems to me. People are quite interested in shopping around for their Apple products or new cars, but not many people would enjoy spending an afternoon looking at different health insurance policies. And I think certainly when I try to talk about healthcare economics and models, I assume that's why people aren't interested, because I have an engaging personality. What I'll focus on is what I believe has led to there being a gap in the market for healthcare delivery for this sort of care for kids. But if I can make it a bit interactive, are there any other fake medical doctors in the audience? No? Good. That'll give me free rein. And any parents of young kids under 10, say? Not many at the moment. So look, if your school or childcare called up in the morning and said, oh, your kid's had a fever, and you go pick them up, it's in the middle of the day on a Wednesday, and they don't look great, and you want to get them checked out, who would you go to for healthcare anyway to get them checked out? Anyone who put their hand up?
Facebook.
A GP.
That's right. And any comments on the experience of people with their GPs looking after their kids' healthcare, especially those acute short-term problems?
Queues.
Sorry?
Queues. No queues.
To get into the GP? Yep. Anything about that sort of quality or... has anyone been sent by their GP into an emergency department? Yep. And any comments there?
Well, my 9-month-old daughter up in Surface Paradise, last day of the year, terrible asthma attack, went to the public hospital. It was full of people with broken bottles sticking out of their head, blood on the floor. They looked at my little baby girl not being able to breathe, and they just went just like this, and we ripped around the corner to the private hospital.
Yeah.
And they saw us straight away. So there was no time for politicking or evaluation. It was just get oxygen into my little baby. You know, and luckily we weren't in the back of nowhere. She would have died.
Look, final bit of preface before I actually start telling you stuff is that yesterday I heard on the radio the fellow Steve Hamilton, president of the AMA, who I think a lot of the public would just assume represents the opinion of medical doctors, arguing that Steve Hamilton was saying that the low acuity patients in an emergency department are not GP patients, that they're somehow inherently different. But if he's right and I'm wrong, then me and my family will soon be living on the streets. So I've taken a bit of a bet on this. What the clinic will offer is especially nurse practitioners. So has anyone heard of nurse practitioners, or at least know what they do? So as I would have suspected, half of, probably a lot less than half of the audience. So they're individuals who have trained as nurses and worked as nurses. They're usually quite experienced, and then they go through some more training that's 1 or 2 years, and it's under a new body that is called the College of Nurse Practitioners. And after that, they are able to practice within a limited scope autonomously. So they're able to do the 2 things that traditionally nurses can't do: make a diagnosis, say what's wrong, and prescribe medication. There have been quite a few in very specialist areas like managing diabetes or cystic fibrosis, but what's become quite popular in the last 10 years are the NPs, as we call them, working in emergency departments. And in a place like the Mater Children's, in the emergency department where I work, the nurse practitioners who work there perform easily to the standard of a trainee registrar, of a doctor who's not only gone through medical school but is well into their specialty training in paediatrics. Now that's not to say that they're equivalent, but within that limited scope of children's emergency presentations, they're very good. And I certainly haven't worked out any theoretical or academic way in which they think or problem solve that is different to doctors once they reach that expert level. What's led to this? What has led to this situation where I'm setting up a private clinic and risking a lot of time and money on what I hope will be popular with the community? It really is the system as it is has created a shortage, a lack of experienced, trained health professionals who are particularly interested in paediatrics and children's problems, and especially the acute emergency ones. Again, interact with the audience. Anyone familiar with any of these issues in the health sector? Anyone want to hazard a guess as to what has led to this? Yes?
Normally the AMA, and there's been lots of political issues about nurse practitioners.
There certainly has.
What's gone on for 20 years, and
yep.
In the US, nurse practitioners have gone ahead, but in Australia.
Entirely true.
There's also the issue with pharmacists, where once upon a time we were regarded as a triage system, particularly in the country.
Yes. And look, I think it's fair to say that in some places that's still true, but yeah, in others it's not valued at all.
Can I guess that there's a college of paediatricians standing on the road somewhere?
Yes, yeah, I'll get to them, to us. Because, yeah, really this is most of all a story about medical accreditation of medical qualifications and training. So it seems to me that what has intersected to lead to this need is that, as audience member has accurately identified, doctors have been keen to monopolise any sort of healthcare and are very reluctant to let go of any roles, even ones that before our very eyes we see other professionals doing very well, including pharmacists. And the AMA has been very active trying to paint a bad picture of nurse practitioner clinics. But I'll also just try to paint complexity because within, let's start with paediatrics, within the College of Paediatrics, doctors who, the College of Emergency Medicine and the College of Paediatrics, or our division in our college, emerged at a similar time, late 70s, early 80s, really what's happened is that the emergency college and the emergency physicians have just taken over the emergency acute care of kids. From the paediatric side, I reckon that too many paediatricians are now doing stuff that isn't really core paediatrics. And does anyone in the audience want to have a guess as to what sort of things they're doing now?
like going around inserting IVs into everyone because nurses like don't know how to, or with, especially with kids, the bone injection.
Oh no, I mean even more broadly in terms of the role that a paediatrician thinks they should have.
ADHD.
Sorry?
ADHD.
Yeah. So certainly trying to get into child psychiatry, which I don't think they do very well. That's not a comment about ADHD or autism. That is just whether paediatricians do it well.
Is the answer everything?
Sorry?
Is the answer everything?
It really is, because they're certainly one of the biggest nanny state groups of thinking that they can be public health physicians as well as being clinical paediatricians, that I don't think it is they can.
I think what you're referring to is like basic checks of babies when they're perfectly healthy, and doing all those little tiny things which a nurse really could do, but they sort of invest their time and you invest your hundreds of dollars and
absolutely. And
the
complexity of that is that the current business model in hand with the government has set up that cash cow. But paediatricians have left acute care of kids largely alone, whereas the emergency physicians have taken it with great relish. But what that means is that as the system has evolved in large mixed emergency departments, like the one that I do work at now on the Gold Coast, kids are a forgotten element of their care, and that's a common story that Julian has just told. Because kids don't come in full cardiorespiratory arrest very often, so they're just not usually as exciting to emergency physicians. It's not their fault. Paediatrics let it go. And in terms of general practitioners, I'm sure that if you have a kid with a fever or who's vomiting or has some fairly common child's presentation, that GPs now are less confident and expert managing those presentations than they were 10 or 20 years ago. Anyone want to hazard a guess as to why that is? And it's only speculation on my part.
They're less prevalent.
Yes, that's right. They're much less prevalent because of the older population with more complex medical problems that we can keep alive and in good health, but take a lot more input from healthcare and GPs, and this has just really left this gap where if you have a child who is 9 months and has breathing problems, I think parents more often than you would believe struggle to get somebody who's confident looking after their kids. I better leave it at that for time. Thanks very much.